First of all, I would like to welcome you all to the Baby Show. It's a fantastic place to come to get lots and lots of information. I'd like to talk to you about Tresillian, a little bit about who we are before I get into the talk on sleep and settling. So Tresillian is staffed by nurses, midwives, mothercraft nurses, and we help parents with children from birth up until the age of 5 years. The most common questions that we have are about sleep and settling, of course. We have 3 centres across Sydney. One is in Canterbury, one is in Willoughby on the north side, and one is in Penrith. We have a telephone service which is from 7 in the morning until 11 o'clock at night, and you can call with any question that you might have. And there's no more queuing anymore. You just leave your number and we call you back within a short space of time. You can also come in for a day stay if you live in that area and come in to see if there's any questions that you might have on sleep and settling, toddler behaviour, feeding, all those sorts of things. Also, we have an outreach service. So if you're in that area, in that local area, a nurse can come to your house for up to 2-hour visit to help you in the home with any questions that you might have, breastfeeding, sleep and settling, those sorts of things as well. To get an appointment at Tresillian, you just need to see your early childhood nurse, your pharmacy nurse or your doctor, and they can do a referral online. Or they can fax a referral to us as well from our health website. We have a website as well that's full of lots of information on anything to do with babies from birth to 5 years of age. Okay, so we're going to be talking about sleep and settling, which is the most common question that people have. So when you bring your little baby home from hospital, a lot of people think that your baby's going to sleep through the night pretty quickly, but they don't. And there's lots of different stages that babies go through, and I would probably urge you to not be too anxious about getting your baby into a very strict routine right from the very beginning, because they're not actually designed to do that so much. Little newborn babies are designed to wake up, and if you've chosen to breastfeed, they do need to be breastfed quite every couple of hours overnight, and if you choose formula, it's the same thing. Little babies do wake up quite a lot overnight, and sometimes up to 6 to 8 months we're still feeding them overnight. Okay, so sleep and settling. There's lots of things that babies do as well to give you cues that they're ready to go to sleep, which people can misinterpret. When babies are first born, they need to only be up for about an hour. So when you get your baby out of the bed, feed, change and back into bed, it should only take 60 minutes. Babies don't like to be up for very long. From about 6 weeks of age, you can keep your baby up for about an hour and a half. But after that sort of time, they start to give you cues that they're ready to go off to sleep. So clenching the fists, scrunching up the face, things that actually look a little bit like they have wind can actually be tired signs. They're tired signs or signals. Also, if your baby starts to disengage with you, so looking away from you and trying to miss your gaze, that's also another cue that they're ready to go to sleep as well. Okay, so the sleeping basics. Babies do really need to sleep, and we do encourage that, as we all do need to sleep, where we need to restore our bodies and our minds as well. And around 40% of childhood is spent sleeping. So getting your baby to sleep does depend on the personality of your baby. It also depends on how good they are at regulating their body and what sort of environment they sleep in, and what you're like as well, as far as setting in patterns and routine and calm environment as well. So sleeping rhythms start to develop around about 6 weeks of age. Babies up by 3 to 6 months, some are having regular sleep and wake cycles. So don't be too anxious if your baby's not getting into a sleep pattern very early. They're not designed to do that. So sleep and wake cycles are regulated by light and dark, and you may have heard about people that do shift work. They can't sleep particularly well because they really need to be in the dark to sleep. And so when little babies are born, it takes a little while for the brain to recognise these things. So between 12 and 13 hours is the average amount of sleep the babies will get in their first year. And in the first part of their life, they'll be very, very short bursts of sleep. So your baby may wake up after 45 minutes, and people get very stressed about that, but it's a fairly normal thing. Some little babies will need you to come and resettle. Some will actually just resettle themselves. Most need a little bit of help. Okay, so any changes that you have in your routine. So you might have established a sleep routine already and your baby might be happily going to sleep and waking and resettling. But anything that happens in your family and your household can actually change what goes on with the sleep. So relatives coming to visit, a little holiday, a little bit of an illness can completely throw the sleep routine out. And that's for toddlers as well. So that's why we like to keep things as routine and as regular as possible and as calm as possible. Okay, so there are some babies that do settle themselves, and we really hope that that happens with us, but there are other little babies that do need a lot of help and support to get to sleep, like adults as well. Some adults really can't sleep very well and need lots and lots of help. So if you wake up in the middle of the night, you might have to go and get some hot milk, or you might need to read a book or some of those other things to get you back to sleep. Some little babies, of course, need lots and lots of encouragement to get back to sleep. And we try to do that as much in the cot as possible, with hands-on settling, with attention, and very much a calm environment as much as you can at 2 a.m. Okay, so it's really good to put the baby in a darkened room, and it's really good to put the baby to sleep in the same room and in the same bed every single sleep time. So the difference between day and night, well, they really need to have the same routine, so the same bed. So if you're tending to put your baby to sleep downstairs during the daytime and upstairs at night time, there comes a time where that's not actually going to work anymore, because they need that same association. It's like sleeping in a completely different place. So we want routine, and we want them to feel really secure as well. So always the same place. And a routine as well. So even at an early age, even at this sort of age, you can start reading your baby a story before bed. You can sing songs, you can do massage, you can do all sorts of little routine things that gives your baby a cue that it's time to go to sleep. Like we do. We might get changed, we might clean our teeth, those sorts of things, and we're telling our body and our brain it's time to go to sleep. Little babies need the same thing, and toddlers in particular really need very, very strict routine. Okay, so sleep cycles for babies can be 40 minutes, and this is one of the most common questions that we have at Tresillian. How can I get my baby to sleep through another sleep cycle? My baby only sleeps for 25 minutes, or my baby only sleeps for 45 minutes. This is quite normal. Some little babies will wake up really, really tired, and we go through the settling routine again to try and encourage them to have yet another sleep cycle. Some will wake up and smile at you after 40 minutes. There's no chance you're going to get that little one back to sleep if they're smiling at you. And as I said before, bedtime routines are really, really important. So around about 3 or 4 months, we're really trying hard to keep them in a good routine. It doesn't mean that you have to stick to a really, really strict program and nothing can vary from that program. But having a plan is a really good idea, and having a series of things to do is ideal. Okay, responsive settling. So we really want to try and be in tune with our little babies, and it's really good to get cues and things from each other. So if you can imagine, and normal behaviour, that's really interesting. What is normal behaviour? Little babies will sometimes start to, as I said before, scrunch up their face, or they might squeeze their hands together or arch their back, and they can be signs of sleep, that they need sleep. A lot of people think that arching the back is some sort of a pain. In some instances it can be, but it also can be a sign of tiredness as well. So you can choose to settle your baby in your arms if you want to, and with lots of little babies we tend to do that. Little babies don't tend to go off to sleep on their own very much in those very, very early days, and it's not creating a bad habit to put a little newborn baby to sleep in your arms. We want them to be calm, we want them to be happy. We also want new parents to get some rest as well. So the most common way of settling is actually settling in the cot, and that's what we would really encourage at Tresillian as well, is to do some strategies where you do hands-on settling. So that means patting, rubbing the baby, doing massages, a little bit of rocking, those sorts of things. And if your baby's getting distressed, definitely pick them up, We don't want to do lots and lots of crying in the cot as well. It's all calm, hands-on. So basically the hands-on settling is just that. You put the calm, well-fed baby into the cot. See what happens. If the baby starts to grizzle a little bit, put your hands on your baby, talk to your baby, lots of little shushing sorts of sounds, and then you can move away if you want to, or you can just stay there and pat your baby to sleep, and that's fine for little ones. The other one is called comfort settling. It's also for babies about over 6 months of age, where you're pulling back a little bit with the amount of effort that you're putting in, and you're there with them all the time. You don't leave them to just cry themselves to sleep. It's first of all, always you put a very calm baby to bed. You would never put a crying baby into bed to go to sleep. You want them to be really calm, because you want that cot or that bassinet to be a really calm and a cosy place. You know yourself, if you're upset, you can't go off to sleep. If you're relaxed, you'll be able to fall off to sleep a lot more easily, and the same applies to our babies. So comfort settling is another one that we would use. So we calm the baby and actually move out of the room. And we don't time any of this. We don't say, well, okay, in 10 minutes we'll go back in, or we don't leave the baby to cry for 5 minutes and then leave them to cry for 10 minutes or 15 minutes. We don't do any of that anymore. It's listening to your baby to see what your baby's actually doing. So some little babies will start to grizzle and make a few little noises. You don't really need to go back in at that stage. But if your baby's getting upset and the crying's getting worse, then you definitely go in. And the first thing you would do is use your voice as a calming technique. You don't want to run straight in and pick the baby up. You want to start at the beginning. So if the calming words don't actually work, then you go to the cot and put your hands on the baby. Maybe do some patting and massage. If that doesn't work, you may actually pick the baby up to calm the baby down. And then once your baby's calm, pop the baby into bed again and go out, and you repeat that. But at any stage, if you're getting very distressed or stressed and you think the baby's getting really upset, then you stop. And it's okay to stop, have a little break, maybe have a little walk in the garden, change the scenery a little bit, and then try again a little bit later. At no stage do we want you getting really upset about trying to put your baby to sleep, because all of that stress will reflect on the baby. So we want it to all be nice and calm. Okay, and as I said, if it gets stressful, just stop and change. Self-settling. This is something that every parent wants their baby to do, is to settle themselves. And the thing is that babies do wake up during the night. We all wake up during the night, but we've managed to get ourselves into a position where we can actually just resettle ourselves. So it's not a question of not making them wake up, it's a question of how they get back off to sleep. So with a toddler, we would try this, certainly around 12 months of age and over, to try to do some self-settling. And it means, once again, it's just another version of the in and out of the room technique, but you actually try not to touch the baby terribly much, but you are present there. So as your baby gets used to this, you might sit next to the cot for a little while, and you can tell your little one, lie down, and mum or dad will stay with you for a while. And once the baby gets a bit used to that, you can move the chair a little bit further out and eventually get out of the room, and then they can self-settle. But it's all about, if the baby's crying or your toddler's really, really upset, it's really important to go and respond to them straight away, because it gives them a sense of security, which is what they all need. Okay, and what I was talking about, the gradual withdrawal, which is moving out of the room slowly rather than just popping the baby in the cot and just going out, because certainly around about the age of 12 months there's a lot of developmental changes going on in a little baby, and they tend to want you a lot. They tend to have a lot of separation problems at that sort of age, from about 10 months to 12 months. And so if you just put the baby in the cot and leave without actually going through a few routines, they can get a bit unsettled. And so if we move out of the room slowly, it seems to take a long time, but in fact it doesn't. It might take, I don't know, maybe a week or two, but it's a lot quicker process than going through a lot of the rocking to sleep in arms and all those sorts of things, which take a long time to get out of. Okay, there are lots and lots of things that we can do to help settle babies. Pouches, for example, like this little baby was in, rocking in the pram, those sorts of things are really nice. Relaxation baths, if you're relaxed, the baby will be relaxed as well. And feeding, and definitely getting a break. If you're a really overtired parent, you're not going to be able to do this sort of settling particularly well. So one of the best pieces of advice I could give you is if people ask, can they help you in any way, take any offers of help that you possibly can. Even though you think you might be able to do it yourself, having a break is wonderful. If you have any questions at all, you can call the Tresillian Parent Helpline. As I said, it's a service. We're there from 7 in the morning till 11 o'clock at night, 7 days a week. We also have a stand just down the end of this hall here, and we can talk to you about any problems that you might have. Are there any questions at all on sleep and settling? As I said, sleep and settling is one of the most common questions. We have advice on feeding, breastfeeding in particular, and introducing solids, toddler management, toddler behaviour, and sleep in toddlers as well. Food refusal in toddlers. So there's lots and lots of things that we can help you with. Would anyone like to ask a question? If you have any questions, please come down. There's 2 other nurses that are working with me today down there, and we can give you some advice today, and we can also give you some information on how you can contact us. Thank you, and I hope, oh yes, of course.
But if all of those techniques don't work, is there any other way to settle
Okay.
with her? During the day she's really good, but during night, especially from 12 till 3 in the morning, she just wouldn't sleep, and sometimes she gets to a point that she's too angry that she gets red and
Okay. The question was, what if all of these techniques don't work? And the reality is sometimes they don't work. That's what it is. How old is your baby?
4 months this week.
4 months, okay. So this lady was saying her baby wakes up quite a lot through the night and sometimes gets really angry and won't go back to sleep. A lot of things, sometimes you just have to abandon your sleeping techniques and just take the baby out and sit and read, sit and cuddle, maybe an extra feed, something like that. And babies do wake in the middle of the night, unfortunately. But if you can be calm yourself, that would be the number one thing that will help. Sometimes you just have to sit and enjoy your baby in the middle of the night. But extra cuddles, those sorts of things, come out of the room, give yourself a break, and then try again. Any other questions? Yes. Yes, you can settle your baby in your arms.
Settle in the arms and then they stop crying. Put the baby down and it cries. Pick it up,
Okay,
stop crying.
yes.
Down.
The yo-yo effect. Okay, so the question is, if you settle your baby in your arms and then you put him into his bassinet and he wakes up, this is really, really common. So the idea would be, if you can initially try to settle your baby some sort of way. When they're very newborn, lots of contact is really, really important, and we do stress that. And as they get older, we would try to do settling in the cot or in the bassinet, those sorts of things. Yes, they do definitely wake up. But with a little newborn baby, if you find that it's taken you forever to get this little one to go off to sleep, if you can hold your baby in your arms for even a little bit longer, maybe even half an hour before you put them into the bed, sometimes that can stop them from waking up. But when they do that, it's a sign that they're really, really overtired. And sometimes you just have to say, well, I'm just going to sit down on the lounge and let this little person sleep on me for an hour. Sometimes that's just what you have to do with a newborn baby. And it's not creating a bad habit, it's creating a lovely bond. Yes, any more questions? Yes.
I listen to radio before I go to bed. Any research about using music?
Using music, absolutely, absolutely. In Tresillian, we have music on all the time when we're settling babies. It provides not only a distraction from any background noise, but classical music in particular, not the modern stations, but the classical music very definitely has a positive impact on the brain and calming us. Yeah, it's a great idea. Any other questions? Yes.
How would you know if they're colic, if they have air or wind?
Okay, how do you know if they have colic? A specialty of mine.
Yes,
Okay, so what is colic? Colic is basically a word that we use to describe a windy baby, and most little babies do suffer from this from time to time. So colic can be, they will have red face, they'll scrunch up their body, sometimes they arch, sometimes they scrunch, pass a lot of wind, lots of gurgling going on. So we generally do refer to that as being colic. And colic can be something that becomes worse if babies are drinking too quickly or if they're drinking too much. So if you were breastfeeding, what we would do is try and support you in how to breastfeed in a certain way to stop the extra lactose that you get. So say feeding on one side a lot longer. And if you were formula feeding, the first thing we would suggest is getting a very, very slow teat and actually making sure that the baby feeds really, really slowly. So a bottle of formula, you would expect your baby to drink in over 20 minutes. If they're drinking it less than that, that's probably going to get weaned. Yeah.
So with the bottle, should I use one or two because they have numbers?
They do have numbers, and every company has a different standard as to what is fast and which is slow, and the babies suck very differently as well. And so I would probably try a few. Don't buy lots and lots, but just try a few teats, and lots of the teats can fit onto the different bottles, but I would go for the slower one as a first choice, definitely.
One is the slowest.
One is the slowest, but sometimes you might have to change brands as well to just see which one's the most suitable for your baby. Okay. All right, I think it's time to go, but if you have any more questions, please come and see us down on the stand.